It's nearly 7 o'clock in the morning, and we've been up since about 5:30 because the bombing's been really bad this morning. We've been watching jets screech past our heads and then drop bombs on the neighbouring vicinity. I'm standing on the balcony of the EMT accommodation, and a really large bomb has just gone off not far to the east of us, and the ambulances here have just readied themselves to go off and pick up who knows how many casualties. So I think we've got a lot of work heading our way.
Well, Dr. Rose joins me now from Nasser Hospital in Khan Yunis. Thank you so much, Dr. Rose, for joining us here on the programme. Your video diaries have been crucial in documenting what's going on there because, of course, we journalists can't enter Gaza. So your work is critical in helping audiences, helping people understand. But just help us better understand right now the situation at Nasser Hospital, because, of course, it's one of the last functioning hospitals in Gaza. Just tell us where it's at right now.
Well, the situation here is pretty dire because we found out on Tuesday that we are not far from the active fighting zone. In fact, on Tuesday, the evacuation order came out and we were following it on the IDF website. And we are 1 square away, which is about 4 streets or 1.5 kilometers. And so on Tuesday, we actually lost quite a few of our staff because they had to go and evacuate their families, because they were living in that area of East Khan Yunis. But what's really worrying for us is obviously the closer the IDF gets, the more likely we are to have to evacuate Nasser. And we are the last remaining full functioning facility in the south that has ICU capability. Although we are surrounded by some amazing field hospitals, we have UK Med and ICRC and MSF Belgium not far from us. And we also have the Jordanian hospital and the Kuwait hospital. They're all field hospitals, so they're essentially tents. They can't take on the complex surgery that we're doing here. They have no ICU facilities and they have no generated oxygen. Nasser at the moment has 2 adult ITUs, each housing 12 patients. Then it has an overflow ITU, and then it has a pediatric ITU. So if we get evacuated, no one can take those patients. And if we get evacuated, all of those facilities together cannot cope with the number of patients that Nasser has. So we are really, really concerned about the prospect of lots and lots of people dying if the IDF get any closer to us.
And Dr. Rose, does that feel, because you are now very close to the active fighting area, does that now feel imminent? I mean, you have said you've lost colleagues who have had to evacuate, who have lived in that area. But does that now feel like any day now, you could be asked to evacuate?
Well, looking at the way that the ground offensive is being run, the plan is for the IDF to come further in from the east towards the Saladin Road. And if that happens, that cuts us off from Al-Aqsa, which is the next nearest hospital to us. And it's estimated that about the way that they're progressing, we've probably got 4 or 5 days before we're looking at being in an area that the IDF will be advancing into.
Dr. Rose, your skills are crucial in this active war zone, plastic surgeon. Just talk us through the kind of scenarios and situations you've had to deal with over the course of the last week or so.
Well, we've had a lot of mass casualties on this trip, so we've been non-stop busy. I started at 8 o'clock this morning, and I was worried that I wouldn't finish in time to make the interview. It's 11:30 here, and I didn't get back until about 11:15. So it's really long days. I'm doing about 11 cases a day now. They are all bomb injuries. So the bulk of what we're seeing is either a burn, which is probably 50% of them, and those are major sort of heat burns from the explosion, lots of them in children. Half of Gaza's population is children. So lots of really small children with huge burns, all in the resuscitation level of sort of 30 to 40%, burns that are often unsurvivable in the Western world. And then the rest of the injuries that we're seeing are basically due to when a bomb goes off, whatever is around you gets whipped up in the explosion. So that may be masonry, bits of car, whatever. That then gets ejected at quite a high velocity and will hit a civilian. And if it hits you in the head, abdomen, or chest, it normally kills you. If it hits you in a limb, it's possibly survivable. And those are the people that are being brought to us. Some of them are already missing parts of their limbs when they get to us. So hands blown off, feet blown off. Feet blown off is a very common injury here. And they may well have other injuries, broken bones, skin loss, and that's what we're dealing with. We're trying to get the wounds clean enough to close. And obviously, this is going on for people that are living in tents. So the whole environment is very dirty. The wounds are very, very dirty.
Dr. Rose, in terms of, if when this conflict ends, I mean, how do you see the picture of Gaza given the scale of the injuries, the death, the destruction, the casualties, everything that you're talking about?
Well, I think we're at that critical point where we have a moment where we could change this if the war stopped now and we got aid into Gaza. That the main thing at the moment is to look at the humanitarian crisis that this has created. We really need to get more food in. The trucks that got in today just aren't enough. We haven't had any medical aid to us since the 2nd of March either. So we're running out of all sorts of consumables. We've run out of scalpel blades. We're running out of betadine. We've also had a restriction on the number of aid workers that can get in. And I think once that lifts and people can get in and start helping, then we do have a chance to certainly rebuild the healthcare sector here.
Dr. Rose, we're so grateful for your time, and I know you've had an incredibly long day, so fitting us in right at the end to tell the world what's happening is crucial. Thank you so much.
Thank you.